Hello, good afternoon. We are here in Bad Krozingen in the University Heart Center Freiburg Bad Krozingen. My name is Thomas Zeller. We are here in our peripheral cath lab where we are doing the majority of our peripheral interventions, including renal denervation. And we are going to perform today a renal denervation procedure using a dedicated radiofrequency system, the so-called Simplicity spiral catheter, which is a new generation of multi-electrode catheter offering the option to simultaneously activate 4 different electrodes at the same time, with this potentially reducing the treatment time as compared to the former Simplicity flex catheter. The patient who we are planning to treat today is a female patient, 55 years of age, with a known history of hypertension since 2 years now. We performed a 24 hours blood pressure measurement. This has shown a mean value of 149/88 millimeter mercury, with a very low drop during night time. So per definition she was a non-dipper. And due to the insufficiently controlled blood pressure under 4 antihypertensive medications, we indicated the treatment with renal denervation. So after excluding other secondary causes of hypertension, and we are planning to perform the denervation procedure just right now. So now we have here our guiding catheter. It's a 6 French guiding catheter. The configuration is an EMA configuration, which fits usually in about 80 to 90% of the anatomical condition of the offtake of the renal artery. And I will now introduce this guide wire to navigate the guiding catheter to the origin of the renal artery. We are inside. So the next step then is to introduce a 14,000 guide wire. That's an uncoated 14,000 guide wire. In this particular case, it's a Galileo extra support wire, which gives us enough support to introduce later on the spiral catheter. So overall, the length of the renal artery seems to be about 4 centimeters, so pretty long, so that we can perform 2 denervation cycles at least. So now we have here the Simplicity spiral denervation catheter. There we have the cable which will be connected to the generator. So it's a very flexible tip. Again, that's the shape of the spiral. To get the catheter mounted to the guide wire, we have here a tube which straightens the catheter and should facilitate. So it's done. Rapid exchange, that means that the guide wire is coming off the catheter shaft after a few centimeters. So that's a 14,000 guide wire with a stiff body, and the stiff body results in a straightening of the spiral shape of the denervation catheter. And what you can see now, I'm pulling back the guide wire slowly, and the most distal part of the guide wire is becoming progressively floppy, and you can already see how the catheter gets its spiral shape back as soon as the guide wire is pulled into the catheter, and this is now the original shape of the spiral catheter. The diameter is big enough to fit for a renal artery diameter of up to 8 millimeters. And if the artery is becoming smaller, you can see the catheter straightens, and we can treat with this device, with this single device, renal artery diameters between 3 and 8 millimeters. So now we can see the 4 radiopack markers of the electrode, and despite this very tortuous course of the artery, we can see how nicely the catheter tracks over the guide wire. And the goal is to advance the catheter into the renal artery as far as we reach the bifurcation in the main side branches. The next step is now then to pull back the guide wire to enable the catheter to get its predefined spiral shape. Now we can see that we have 4 curves for all the 4 electrodes, and what we are looking for here before we start the energy application is basically that we have a stable impedance. The contact, the wall contact is perfect. What we can do in addition is to improve the wall contact a little bit is we can turn the spiral catheter slightly, and this results then in a further increase in wall contact. So now we start the ablation cycle. So, well, what we see is now we had no drop in impedance and no increase in temperature with the first electrode. So it seems that the position of the electrode was insufficient or was still located at the origin of one of the side branches. The blue curves represent the increase in temperature, and the white curve is the decrease in impedance. There are also the percentages in drop of impedance given as percentages. And we have now an increase in temperature at the most proximal electrode to 52, then in the second proximal to 61 and 55. So we have now performed 3 ablations, and I will pull back the catheter now, and I'm turning the catheter again and push it a little bit forward to enable again a proper wall contact. So we have again a pretty stable impedance. Okay, let's restart. So now you hear the last 5 seconds, and we have successfully delivered now another circle of 60 seconds of ablation. So the major differences between the Simplicity flex catheter and the multi-electrode device, the spiral catheter, basically is here we have 4 electrodes which can be activated simultaneously. With the flex system we have only 1 electrode which is activated for 2 minutes overall per cycle, and here we have a runtime of only 60 seconds. So besides the feature that it's easy to introduce because we have to position a guide wire, and the catheter tracks easily over this guide wire, we have also a reduction in overall treatment time. 7 ablations, 3 during the first run and now 4 during the second run. So, well, the vessel wall is pretty smooth. We can almost see no notches and no spasm. So the artery looks perfect. So now I'm rotating the guiding catheter towards the expected origin of the right renal artery, probably here, and then I'm advancing the spiral catheter once again into the renal artery. Now we should be in the correct position here. So the tip is already in one of the segment arteries. I will pull back now the guide wire to enable the catheter to foreshorten a little bit, and then I'll rotate the catheter, and now you could see how it jumped out of the side branch. I will change the orientation a little bit, and now you can nicely see here the round shape of the spiral. Impedance is stable, so let's start. the denervation. Now we have a nice drop again of the impedance, but overall we had a significant increase of temperature. We had a decrease in the impedance, and like with the flex catheter, there's an algorithm implemented in the generator that stops the energy application, the radio frequency energy application, in case that there is insufficient drop of impedance or insufficient increase of local temperature. I will pull back now the catheter into the proximal part of the renal artery, and that I would like to start another run here in the proximal renal artery, that in total we will end up with 8 ablations. We have a stable impedance again at all electrodes, and start now the last cycle. So the most proximal electrodes seem to be not in a proper wall contact, whereas the distal ones, the 2 distal ones, show a nice increase in temperature and also a drop in impedance. So the renal artery itself has a spiral shape here, and that probably explains why we have had no proper wall contact. So what we can do is basically pull the guiding catheter back. I would like to do another ablation with the proximal electrodes. The wall contact seems to be better. We have a decrease in impedance now with the 2 proximal electrodes. We have an increase in temperature. Looks pretty nice. So, well, now we have performed or delivered 8 successful denervation cycles at 8 different spots. So we are also done now with the treatment of the right renal artery. So here we see the so-called notches. It's not spasm. So now I have removed the spiral catheter. We are done with the procedure.